Hi, let's talk about neonatal RDS today. So, neonatal RDS, the full name is Neonatal Respiratory Distress Syndrome, previously also known as the hyaline membrane disease. Actually, it is a very, very common lung condition in preterm babies. So, let's get started. If your baby is more premature, actually, the incidence of RDS is higher. And also, over 90% of the extreme premature baby has the RDS. So when you see a very premature baby, most likely they would need some oxygen or they need some respiratory support when they give birth. This is due to the RDS. Of course, have other differential diagnosis, but RDS is top on the list. Why this happen in preterm baby? Actually, RDS is due to the deficiency of surfactant in immature lung. Surfactant is being synthesized at 24 to 28 weeks. So you can imagine for those preterm baby, they will not have enough surfactant inside their lung, and this leads to RDS. So what is surfactant? Normally, inside our alveolar is like this. We have some water here. Okay, so we have some water molecule here. So with water molecule on the surface, we have something called surface tension. So it is the force between the water molecule. This tends to collapse the lung. Surfactant is something that helps us to reduce the surface tension here so that it can prevent the lung collapse. So you can imagine for premature baby, if they have not enough surfactant, it is very easy for the alveolar to collapse. So what happens if after the lung collapse, they will have the hypothermia? So they need some respiratory support. So after knowing this, we talk about the risk factor. As mentioned, more premature baby, those baby with cesarean delivery without a neighbor, or those baby with perinatal asphyxia, or if the mother has the maternal diabetes, have the GDM. How did this present? So just think about it. It is a lung condition, right? So the baby will have respiratory distress. It's usually happen within minutes or hours after birth. What are the signs when we have the respiratory distress in neonates? We have nasal flaring. The baby nose will have the flaring. The baby will have insucking, like the subcostal insucking, the intercostal insucking. Seems that it's very hard to breathe. Also, baby, more severe case, baby will have grunting when they have the respiratory distress. Clinical cause, if without the treatment, actually it will progress within 2 to 3 days of life and resolve after 1 week of life. But then usually we need the treatment for this because it can be dangerous. So what are the complications when you're talking about the lung, talking about hypoxemia? It can lead to death if without any treatment. So therefore, we need to have the pediatrician to stand by when we have the premature baby. And most of the time, this kind of baby will need some ventilation or oxygen therapy. With long-term oxygen therapy or ventilation, it can lead to some complication like chronic lung disease or bronchopulmonary dysplasia. It's due to when you have long-term ventilation, you have like barotrauma, oxygen toxicity. It can lead to the lungs develop worse. When the baby grows up, it's easy for them to have wheezy attack or respiratory infection, etc. So another thing is when you have the barotrauma, you have positive pressure, ventilation, it's easy to have the pulmonary leaks, like pneumothorax, okay? And also when you have frequent oxygen, the baby can also have the retinopathy of prematurity. This is a disease of the blood vessels in the retina develop abnormally. It can lead to blindness. So how should we investigate for this kind of baby suspected RDS? Firstly, we take the blood, okay? So because some differential diagnoses include like infection, we need to do the septic workup. Of course, respiratory condition, we need to take the blood gas, right? And also we need to take the complete blood count, glucose, etc. to make sure everything is optimized for the baby. Chest X-ray, of course, the most classical chest X-ray appearance will be the ground glass appearance. Also, the baby will have low lung volume. So how do we manage? First of all, the most important thing is the supportive management. So we need to resuscitate the baby. So we go for ABC for every resuscitation, right? So airway and breathing, we need may need the intubation, depends on the condition, or some better baby may also need some oxygen or high flow cannula, or some non-invasive ventilation like CPAP and NIPPV. For the most severe case, we need the mechanical ventilation, which means they need the intubation. And ABC, the C, we need to ensure the cardiovascular stability. We need inotrope, we need fluid, etc. So also we need the supportive management. We need the fluid. Usually we aim the neutral or slightly negative balance of the baby. Why? Because the infant usually born with positive fluid state. They need to have a little bit negative balance for the lung to be better. Okay, we also need the early nutrition, but most premature baby, we cannot full feed them immediately after the birth, which means we cannot give all the milk to them. So sometimes we need some TPN. Okay, for specific management, the disease is due to the lack of surfactant. That's why we can give the surfactant back to the baby. Usually we give through the endotracheal way, which means we inject the surfactant through the endotracheal tube and into the lung. The best timing will be given within 1 to 2 hours after birth. Is there any measures we can prevent the RDS to happen? Yes, we have antenatal steroid. Okay, the antenatal steroid given to the mother can actually increase the synthesis of surfactant, and that's why when we suspect the baby is going to have the preterm birth, usually we should give the antenatal steroid to the mother to help the baby lungs become more mature and have more surfactant to prevent RDS. So that's the brief overview of RDS. In summary, remember RDS happens in most preterm baby. It can lead to mortality and also morbidity. Okay, for the management, we need the supportive treatment like intubation or non-invasive ventilation like CPAP, BiPAP, and specific management we have endotracheal surfactant. That's neonatal RDS. Thank you. See you next time.